Έχουμε την τιμή να φιλοξενούμε στο ιατρείο μας τον καθηγητή κύριο Richard van Hillegersberg από το Πανεπιστημιακό Νοσοκομείο της Ουτρέχτης, UMC Utrecht. Ο κύριος Hillegersberg είναι καθηγητής στο UMC της Ουτρέχτης. Έχει ένα από τα μεγαλύτερα κέντρα στον κόσμο ρομποτικής χειρουργικής ανωτέρου πεπτικού και είναι ιδρυτής διεθνών εταιριών χειρουργικής όπως της Διεθνούς Εταιρείας Χειρουργικής Ανωτέρου Πεπτικού με ρομποτική τεχνολογία. Η κλινική του Ρίτσαρντ έχει πολύ μεγάλη συμβολή στην έρευνα, στην ελάχιστα επεμβατική χειρουργική και στη ρομποτική χειρουργική με πάνω από 600 δημοσιεύσεις και έχει εκπαιδεύσει πάρα πολλούς χειρουργούς ανά την Ιφίλιο, μεταξύ αυτών και ο υποφαινόμενος το έτος 2014. Richard, welcome to my office. It is again a pleasure to have you here in Greece. Once again, it's very common that I visit your department at Utrecht and you visit us here, and we are very happy to have you here. We will have a discussion about minimally invasive surgery, actually about the benefits that minimally invasive surgery do have to our daily surgical life. My first question would be, in the year 2023, does open surgery has a position in surgical practice for both benign or malignant diseases?
Thank you very much, Aristoteles, for having me here. I enjoy your beautiful office and your team here and the quality of surgery that you provide. Yesterday you were showing a very beautiful video of one of your operations of a kidney, preserving the organ, taking out a very large tumor, which is quite unique, not only in Greece, I think, but also in Europe, to do it that way, minimally invasively, giving the patients the benefit of very small incisions and also to recover fast with the optimal result for cancer surgery. So I think that is a big example of how we should treat patients in 2023 and even beyond. So you're showing us the future yesterday that is here already. Big compliments for that. You were with us back in 2014 visiting Utrecht. At that time a very eager young surgeon willing to learn everything, but with also internally a lot of skills. We immediately recognized that, and we're very happy to have you. You did some great research at our department. We wrote some scientific papers together, and well, it was a great time. And ever since we not only built up a friendship, but also a scientific and professional relationship, and I really cherish that, I must say.
Yeah. I thank you very much, Richard. Actually, my fellowship in UMC Utrecht has had a huge impact in my academic and surgical career. I would like to ask you, what is the impact of minimally invasive surgery for major procedures, for example, big diaphragmatic hernias or reflux disease, or generally upper GI or digestive system surgery? For example, to make it simple to people here in now, minimally invasive surgery means small holes, big operation though, but small holes, and maybe next morning they are home, especially for benign disease, I mean.
Yeah. So there are so many aspects about minimally invasive surgery compared to open surgery. We did research on this, comparing open surgery in the same procedure with minimally invasive. We see that at all points that we were comparing, the minimally invasive surgery patients do better. They have less pain after the operation, complications are less, they recover much faster, the quality of life is better at all time points, so they have at the end a better results of the surgery. We also as a surgeon experience that. Not only that we do the operation through the small openings in the body, which is of course good for the patient, but also we see through the camera 10 times enlarged. So we can see much better all the structures, and we can spare organs, we can follow the anatomical structures, and by that have less blood loss as well. So I think compared to open surgery, there are only benefits. There is little room, very little room for open surgery nowadays. Exactly. We do in the Netherlands more than 90% of the surgery minimally invasively, and we see very rarely that we have to do an open procedure. So in my mind, this is the way to go, and even with the robotic techniques that are now coming into the practice, I think that's the next step.
Yeah, this is very important what you say, and indeed, as now in my department, in my hospital, we are starting our robotic program, of course, which will be proctored and mentored from your behalf from UMC Utrecht. It is important to say that various procedures can either be done with either minimally invasive laparoscopic means or even with robotic means. So I think that in my department it's very important to have this robotic training and this exchange actually with your hospital. What is your comment in general in minimally invasive surgery, robotic surgery, and this program, how could these programs apply to the Greek patient?
You see that minimally invasive program surgery had a big impact on the quality of surgery and the quality for the patient. And robotic is the next step. In robotics, like I said, you see the image 10 times enlarged, three-dimensional image, and you can, with your instruments, with tumor reduction, be very precise. It makes you a better surgeon. That's the end point of that is the bottom line of everything. We would really love to support that from Utrecht to support you to get the program started and be successful. We have now a new system that is the telementoring system, meaning that we can communicate with a surgeon from Utrecht by a telementoring system. We see the intraoperative image, we see the outside image, and we can communicate verbally, and by that guide you step by step through the procedure. So I think that will be a really successful way of introducing this technique, safe way, and it gets the surgery to the next level. So I think for Greece in general, this will be very beneficial. I at the same time realize it is expensive, but and that is of course at this point a little bit the drawback for some surgeons to start. But at the end, the quality is so much higher that it will also pay back, I would say.
I totally agree, Richard. I'm very looking forward for my next visits in UMC Utrecht for our robotic program and for various courses that you organize there. It will be very nice for me to meet you again there or back in Athens.
Absolutely. So we organize a yearly minimally invasive course. Surgeons from all over the world come there to learn hands-on robotic and minimally invasive surgery. And we would like to invite you as a faculty for the next time.
Thank you.
Because I think that will be very, very important to have specialists like you, surgically very skilled, to learn the surgeons from all over the world about this type of surgery. And well, we organized also through the International Robotic Association some courses. Next one will be in Taiwan in the next month. And so we'll have a lot of courses that hopefully worldwide will lead to exposure and lead to dissemination of this kind of minimally invasive techniques to benefit the patient, of course.
I totally agree, Richard. As my last comment, indeed, I have the same opinion that all surgery should be done in a minimally invasive way, and that's what we are doing as well in my department. in Greece, following all the standards we have received from my experience in the Netherlands, in Finland, and in other European countries. Just one last question: what did you like from Greece the most? Our tour and everything.
Well, I love the weather here. I must say it's not comparable to the Netherlands. I love the people, so friendly, so relaxed always. I love the situation that you're at the sea. I was yesterday at the seaport and have some great fish food. So there are many things to enjoy. I have been several times to the Acropolis. My hotel now is facing the Acropolis, so this is a view that you can't get enough of, in my opinion, because it's so beautiful. And you yesterday advised me to go to the Agora of Athens. I was there, and the philosophers were there as well. So you told me, and this has a special vibe, and the city has a special vibe. Love to come here.
It will be very nice next time you come. Again, we visit more places. Richard, it has been so nice to have you here. And again, I thank you for your support all these years, and hope to see you soon.
You're welcome.
Thank you very much.